Hello, I'm Dr. Pulak Vatsya. I'm a consultant of sports orthopedics and joint replacement at Narayana Superspeciality Hospital, Gurugram. Today I'll be talking about shoulder dislocation. So the shoulder joint is a ball and socket joint. The ball is formed by the bone of the arm and the socket is formed by the bone of the shoulder, the scapula. This ball and socket joint is very similar to the hip joint, but the only difference is the socket here is very shallow. With the shallow socket, what is very common is dislocation. Unlike the hip joint, this joint dislocates very often, especially when the patient comes to us with the movement of overhead abduction and backward movement, especially while playing badminton, while playing kabaddi, and they get a jerk. This joint dislocates anteriorly. The problem with the anterior dislocation is the patient usually comes to us in the emergency. They have pain, they have inability of movement, and they have abnormal posturing of the shoulder. So we get an X-ray done for such patients and we reduce the joint with traction in the emergency itself. Now the second problem with this injury is that the capsule which supports the joint anteriorly, because the socket is very shallow, also gets torn sometimes. When the capsule gets torn, this joint starts dislocating more often and in less arcs of movement. So patients come to us with 50 dislocations, 100 dislocations, and they are unable to do their tasks of daily living. For such patients, we get an MRI done. We see how far the capsule is torn from the bone, and we go in with an arthroscope. We do an arthroscopic surgery. We make a small incision of around 1 centimeter. We go in and see the torn capsule and we repair it with a suture. So after that, the patients can get back to the normal life, they can get back to sports, and they can function normally. This is very common in badminton players, kabaddi players, and even patients with seizure disorders. So if you're having a shoulder dislocation and you're having repetitive dislocations, you should definitely go and see your orthopedician or your sports orthopedician to ensure that you don't have a torn capsule, or what we call it as a bank arch injury. Thank you.